Starting to kick off today's session on policy, Councillor Siddiqui's personal, make some noise for that, make some noise. We gotta, y'all could do a little better. I know it's early, but come on, we gotta bring it up. So, Siddiqui's personal history and approach to coalition building for political change has been rooted in community. We are excited to hear more from her. Councillor Sumbul Siddiqui, she/her, is serving her 4th term on the Cambridge City Council and served 2 terms as mayor of Cambridge. She was the first Muslim mayor in Massachusetts, make some noise for that, and the first female mayor to serve 2 consecutive terms in Cambridge. Councillor Siddiqui immigrated to the United States from Karachi, Pakistan at the age of 2, along with her parents and twin brother. Oh, that's so cool. I didn't know you were a twin. She was raised in Cambridge, affordable housing, and attended Cambridge public schools. After graduating with a bachelor's degree in public policy from Brown University, Councillor Siddiqui served as an AmeriCorps fellow. After earning her JD from Northwestern's Pritzker School of Law, she moved home to practice as a legal aid and attorney, serving low-income residents in Greater Boston. Mayor Siddiqui is a champion of guaranteed basic income and spearheaded important initiatives in Cambridge to support a citywide pilot, leaning heavily into community coalitions as she did. Please welcome Mayor Siddiqui.
Good morning, everyone. You should fill out the survey now, not after I speak. I am so glad to be here. Thank you for the introduction. I want to thank Stacy and the Income Movement team for having me. I've really loved being able to come yesterday and hear from so many of you about all the powerful work that you're doing in your communities. So thank you so much for all that you do. It's been such an honor for me to serve my hometown of Cambridge, Massachusetts. As was mentioned, I'm now in my 7th year in office after completing 4 years as mayor this past January. And my story growing up in Cambridge has really deeply informed the work I've had the privilege to be a part of. As was mentioned, I was born in Pakistan, and my parents wanted to come here for a better life. And when they got here, nothing really translated over. And my parents quickly went to go find work, and my dad found work as a produce clerk at a grocery store, and my mom found work as a cashier. My dad also had a second job at a department store as a shipping clerk. And my parents are in their 70s, and they're still working those jobs today. And they're still living in the same affordable housing complex that we grew up in. So their really hard work is really the reason I'm here today. And Cambridge also plays a huge role because the city of Cambridge has immense resources and had immense resources when I was also growing up. I had access to affordable housing, a fantastic public school system. But despite that, like many families, there were days when my parents, I could see them struggle. The childcare for twin toddlers, not being able to go to the laundromat, medical expenses, no access to a car. They watched us grow up, but as we know, they didn't have time to spend with us. They were always working because they had to for us. This was the trade-off my parents dealt with so they could afford this proximity to more opportunity. And so it really went without saying that my brother and I were really expected to propel forward and achieve their version of the American dream, which really meant, professional careers and financial stability. And my brother quickly said, I'm going to go into business. And I kind of said, look, I don't know what I want to do. I want to help people. And I got the first taste of what this could look like when I went to City Hall. I was a high school student, and I became involved locally with others and learned a lot about advocacy and youth voice, and literally went into the room where it happens, where rules and policy were made. And I would look around the Sullivan Chamber, it's called the Sullivan Chamber, and anyone who's been mayor is on the wall, and it was basically all white men. And I said, that's interesting. And so this was in high school, and I said, wow, people come here to advocate on things that they care about. And this is such an important way, it seems, to get things done. And so that kind of early taste of, okay, maybe I could be part of that one day. Maybe I could work to get to City Hall and advocate on issues that affect people. And so this early experience shifted my perspective as an immigrant kid who grew up in public housing in this very rich city, next door to these famed institutions that people, dream of attending, and neighbors who can afford to go there. So after I chose to study public policy, because I wanted to learn about all the public policies that had shaped my life, right? Whether that was immigration, that was housing, that was Head Start, the list continues. And so then from there, I decided I wanted to pursue law and specifically use the law to help people. And eventually, I saw that I really loved working one-on-one with individuals. I loved thinking about also the broader issues that residents were facing and the broader community issues that they were facing. So I became re-involved in the community, which is really important. I became involved in boards. I became involved on some of the issues that were actually happening presently in the city. And that was 2017. And so with my personal connection to Cambridge, my lived life experience, and my experience working with diverse populations, and my interest in policy, I really felt that being in elected office could give me a different platform. So I threw my hat in the ring, and now I reflect on these past few years, and they have really given me the most unique exposure to such a breadth of issues through this combination of policy work and constituent services. And so many of the issues are still the same as what I remember my parents and other family friends facing when I was a child. So I'll bring you to the pandemic. I was a few months into serving my first term as mayor, 2020, January 2020, February 2020. We were laying out some plans that we'd been thinking about, that I'd carefully crafted with team members and kind of that before time. And then this quickly shifted, as we know, to this crisis management, and as we worked to keep a city full of families and children afloat during such an unprecedented global event. And my priority was to reach and meet the needs of residents right away. I then quickly put together a group, and we were able to raise $5 million from philanthropy for the Mayor's Disaster Relief Fund. And this was one-time payments to families. And after that, I kept hearing from families about how impactful even that one-time payment was during such a difficult time. And families continued to ask for more support. So this real-time experience then really planted the seed for what is now known as Cambridge Rise, Recurring Income for Success and Empowerment. And the goal really of Cambridge Rise was to support our families in the hardest of times during the pandemic. But it became clear that the hardest times are really all the time. So I'll bring up some slides. I'm not going to rely too heavily on my slides because there's so many. And reflecting on yesterday's conversations, I think not too much is new, but bear with me as I give you a few. So, as I said, I think when I think about Cambridge, the city had discussed providing some kind of a guaranteed income and how that could be beneficial to residents, but there was always this sense that, that's not feasible, or, we're going to have to study it. The government loves to study things. And then came COVID, and it really forced us to think on our feet and react. I always say, when we were closing down schools, we knew before that kids didn't have internet and laptops at home. We knew that, but we were like, you know what? I'm not sure if we're gonna be able to get them laptops or these hotspots. That's a little too much. But quickly, and most importantly, there was this urgency to say, look, we can actually do this now. We don't have to wait. And so timing is everything. And at that time, I learned about the Mayors for Guaranteed Income, and they had a challenge grant that was providing $500,000 for cities that could match, and they could support 100 families for 12 months. And I want to shout out Catherine from the MGI team, who we worked with. So we quickly were able to raise $1.6 million to support about 130 single caretaker households for 18 months. And this process, it happened really quickly. We put together a really great working group that was made up of philanthropy, all our housing providers, of many other nonprofit organizations, other city leadership, and we basically worked together to come up with this pilot that would then run from September 2021 to February 2023. So the process for this, I think the hardest part, as we may know, was for me, was to secure those public benefit waivers so that people's benefits could not be affected. Massachusetts, we're working on it, any kind of legislative policy that would exempt benefits. And so I took the time to actually meet with every single commissioner of various agencies to get their written support, to get their buy-in, because Cambridge was the first city in the state to be doing something like this. And these waivers were also a condition of receiving the matching grant, along with the resolution that could be passed by the city council. So there were various steps that needed to happen for us to do this. So this is, as I said, kind of 2021. It started in 2021, ended in 2023. The results we received actually came in March 2024. And I won't get too much into the results. It's very similar to what we all know. But I will just provide brief context before I kind of go into how we decided what to do next. So most people know Cambridge as this home of Harvard, MIT, biotech, but the cost of living in the city is actually 73% higher than the national average. And utilities and healthcare are 19% higher here, groceries are 12%, and housing costs are 212% higher than nationwide. So we also know that 1 out of every 10 families with children under the age of 18 live below the poverty line, while 1 in 3 female-headed households with minor children live below the poverty line. And Cambridge residents who are Black and brown are twice as likely to live under the poverty line. And the pandemic just obviously made things worse. And according to the federal guidelines, a family of 3 with an annual income of $21,000, almost $22,000, is considered below the poverty line. The average RISE recipient had an average income of $20,000. So, given this reality, I think as a policymaker in government, I view our role as to help people. And you do that in a lot of different ways. But for me, it was about listening to our residents and asking about what they needed. And the response to getting this program going was very positive. I think the biggest question we got was, wait, why 130 only, right? Why not? Why can't the city do more for our families? And so, even before I had to see any research, because we know cash works, right? I didn't have to rely on that data, and I'm glad most of my colleagues didn't either, to say, look, we should start thinking about ways to expand this to a more citywide program and see what we can do. So, as I said, we were helping 130 single caretakers, and in January 2022, I was fortunate to get my second term as mayor, and then in April 22, we announced that we were going to use $22 million of our ARPA money to then expand and reach more families. And so this process is where I'll kind of spend the bulk of my time, because it was really hard. It was really, really difficult to expand going from 130 single caretakers and 1.6 million to 22 million. And so how we did that took a lot of effort. And so as far as the program design, in June of, I'll just say that in June of 23, so fairly recently, we opened the application process for Cambridge Rise Up, so which this is now providing nearly 2,000 families with $500 per month for 18 months. And this time it's families at or below 250% of the federal poverty level. And they were eligible to apply and receive the payments. And the first payments began in July of last summer. Those who are participating as far as demographics, 52% identified as Black, 11% as Asian, 20% as white, 1.8% as American Indian, and we had about an 8% no response rate. And unlike the pilot, we did not have a lottery, so there was no lottery. We really wanted to make sure that anyone who was eligible could get the money. As you can imagine, when you're doing a random lottery, and we had requirements with the Center for Guaranteed Income, people really felt left out, right? They're like, what about us? And so with this non-lottery design, we said that if you meet this criteria as far as income, you will be able to receive the money. And so we, in our data, had estimated about 2,000 families who were at or below 250% of the poverty line, and we were actually able to meet almost that level of our participation. And so some things I've learned, especially in that process, there was so much bureaucracy. It actually took a year and a half from starting to finish, because I can just tell you there's no how-to guide in some ways to do this in your kind of own community, because there's local context and different things, different housing providers, different agencies that you have to encounter. And even the city, the city had a lot of old school kind of individuals who really didn't get this concept, right? They didn't really they didn't have that lived life experience either, living in poverty. And so they were kind of like, ooh, do we really need to do this? Maybe the lawyers are right here. And so there was a lot of uphill battle with the bureaucrats and me and others fighting to say, look, we can keep going. We can solve some of these challenges that are coming up in our working group. We replicated the working group model that we had, and we're able to still work together and focus on getting this larger program off the ground. I'll never forget the group of HUD lawyers that I had to meet with on Zoom, because they were very much like, I think, they were like, I don't know if you can do this. I don't think we can exempt this and in some of our tax credit properties. So there are all these things that we were running into, and so it was very frustrating. But what kept us going was, we have a goal here. It's to help families. And so we were able to get this program off the ground, and we're helping a range of families. And now it's kind of like, what's next, right? Like, what more is the city going to be doing? And so I'll just share a few more slides until the end. So if anyone wants these slides, I'm happy to share them. These are all, there's information on the MGI dashboards as well, on more specifics about what our first pilot found and so forth. So you're welcome to, I'm happy to reach out with those slides. Kind of gone over some of that. These were some of the key findings from that first pilot. No surprise for folks in the room. So higher employment, improved financial health, enhanced housing, utility and food security, increased time and space for parenting. So one thing that has kept me up at night has been, and it's still keeping me up, is this program will end early next year, our expanded program. And one thing that keeps coming up is how the city, what we'll do to support these families. And so the thinking around this is twofold. I think we have a lot of momentum in Massachusetts right now on the guaranteed income movement. So there's a lot of partners, as you all may know, who want to work together to figure out what is next. And so we've been able to come together. The Bar Foundation has actually facilitated conversations on how to connect and collectively advance some of this work. And we have also a legislature that backed a commission on poverty in Massachusetts. And so we actually, a bunch of us testified in front of this poverty commission and asked for a few things, but essentially I pointed out a few things. You know, I've said to that commission and to others, we know families have varying needs, and the flexibility of unrestricted cash is critical. We also can see that the federal poverty lines are outdated and unrealistic. We also know that families need both cash and benefits to survive. And we also know that the cliff effects of public benefits keep people trapped. So what are we going to do about that? And that is real work. I think as an elected official, politician, you know, some of my colleagues are like, I don't want to touch it, because it's actually, you have to do the work, right? And so much of this, it's not going to happen unless we have people coming together and doing the work. And so in Cambridge, in Massachusetts, the legislature has funded a 3-year pilot which will provide financial support to 100 residents throughout the state who are impacted by the cliff effect. And so I'm hopeful there will be some recommendations that come out, but we know that a worker can earn small increases in their hourly wage or transition from part-time to full-time and lose so much in public benefits that their overall income decreases, and they can then no longer afford basic needs. So make that make sense, right? It doesn't. And so we have to figure out how we fix that, and that's something that this group in Massachusetts, we are coming together to do the work on that. More specifically to Cambridge, I think what I've said is budgets are moral documents. The city of Cambridge has a $1 billion budget, $1 billion. And I'm really proud that as a city, we've put money into universal pre-K. Starting in September, all 4-year-olds will have access to free preschool. We've always dedicated, but we're dedicating more of our operating budget to affordable housing. So why can't we use our operating budget to help families? And so right now I am in the process of working with our city solicitor. We have a new one from our other one retired who was very much like, you can never do this, to this one who is more open, and we're trying to figure out how we can potentially use our taxpayer operating budget to do this, because as you know, we've been relying on philanthropy, we've been relying on some of our budget we have been able to use for research and so forth, but we really haven't said, let's actually use the budget. And so that work I'm working on now. I'm hopeful. I think for me it's about how do we help our families? What do we do to help with their needs? I think the new expansion, there will be a lot of important research, very similar to kind of the research that the open research folks mentioned yesterday. They're going to kind of go beyond the research question of, is cash, helpful for families? We know that answer, but the team at MDRC is going to be doing that extensive, research, and that will be hopefully available in March of 2025. And we have a research advisory council, half of them are residents with lived life experience in poverty, so I hope that those results, and I'm eager to see more on the deeper research that is available from that group. But I think this work is so important. People ask, well, it's just $500. That's just not enough. Well, I know it's not enough. I know it's not enough. But, I think it's absolutely necessary, though, to help people in this moment right now. And people have said, well, you don't know all the answers. I'm like, that's okay. I don't need to know all the answers. I think we have to figure out a process to get to some of the answers, to come together and work with the proper partners, work with our community members, hear from them directly. I think our legacy really can't be a country that waits until people are at the brink of collapse before we, throw a few scraps their way. And so I really do think that guaranteed incomes are the building blocks to support the kind of program and the support and the kind of world we all want to live in. So I want to just close by saying it's been such a privilege to be part of doing this work, because I've grown up in this community, and so I feel very connected to community members who can come to me, who can come to my office and say, I never really thought City Hall could see me, right? I really didn't think I could call someone at City Hall. I didn't think that they would be here for me in this way. We felt really alone, and we have great resources in the city, but it really does take, I think, government and politicians and elected officials in these roles to hear from residents directly and do the work for them, and listen to them, and make sure that they're part of the policy work that is happening. So with that, thank you so much for letting me say a few words. Happy to share any of this, and thank you for letting me be a part of this great conference.